Welcome to this training on basic first aid. Examination. Regardless of the type of emergency situation, you must first protect yourself. Never enter an unsafe environment or you could become the next victim. Form an initial impression. Survey the scene or surroundings quickly. Know any possible hazards to you and the victim before you act. Never approach or touch a victim in contact with energized electrical lines, and never approach victims overcome by toxic fumes until the area is safe to enter. Never move a victim unless there is a possibility of additional injuries resulting from an unsafe environment. If you must move a victim, try to protect the individual from further injury by using one of the following methods: walking assist, two-person seat carry, clothes drag, blanket drag, or foot drag. As soon as you have determined that a victim needs medical attention, activate the Emergency Medical Services or EMS system. Single out one or two bystanders, call them by name if you know them, and direct them to the EMS. The EMS can be activated in most areas by dialing 911. The EMS will need the following information: where the victim is located, who you are, the telephone number you are calling from, first aid that is being given, what happened, how many persons are sick or injured, and condition of the victim or victims. While waiting for emergency personnel to arrive, there are several actions to take to continue treating and monitoring the victim's condition. Maintain an open airway. Continually check for breathing every minute. Note changes in the victim's color and skin temperature. Make sure wounds have not started bleeding again. Note the level of consciousness and check any splinting or bandaging. If conscious, interview the victim to gather information about their potential injuries. Use the acronym SAMPLE as a memory device to help you remember the steps in the process. S in the SAMPLE stands for signs and symptoms. A for allergies, M for medications, P for pertinent medical history, L for lost food or drink, and E for events. If the victim is unconscious, place the individual in the recovery position when no spinal injuries are suspected, and ensure the victim is breathing, has a beating heart, and is not bleeding severely. After you have ensured that the unconscious victim is breathing, has a heartbeat, and not bleeding seriously, start a full body examination. Begin your examination by looking carefully at the entire head. Look in the ears and nose for any sign of bleeding or fluid. This could indicate a head injury. If the victim regains consciousness, ask about the pain in if the person is experiencing any. Continue examination down the body until you reach the toes, checking for broken bones, bruising, bleeding, and any other injury. Severe bleeding. There are three basic types of external bleeding: arterial, venous, and capillary. When you observe a victim with heavy bleeding, remember to always survey the scene before approaching and wear appropriate personal protective equipment. It may be necessary to control heavy arterial bleeding while checking the victim for breathing and a pulse. Blood pulsating or spurting from an artery is an indication that the heart is beating. Controlling heavy bleeding is important, but establishing an airway and heartbeat is your first concern. In most cases, external bleeding can be controlled with direct pressure to the wound. If a clean, sterile dressing cannot be located, do not waste time looking for one. Direct pressure can be applied by placing your hand firmly over the wound until an adequate bandage can be applied. If a limb or other body part is amputated from the body, extreme care should be taken to preserve the part. After the severe bleeding has stopped and proper care taken for the victim, locate the severed part and wrap it in sterile or clean cloth. Place the part on ice or in a container, being careful not to allow the body part to contact the ice directly. An impaled object should not be removed. Stabilize the object in place with gauze, triangle bandages, or a clean cloth. The only exception to this rule is an object that is impaled in the cheek and is blocking the airway. Remove the object from the cheek and apply pressure inside and outside the cheek with a clean bandage. Shock. Be prepared to treat a victim for shock in any emergency situation. Shock can occur very quickly or it can occur very slowly. Although there are several types of shock, this training is going to focus primarily on hemorrhagic shock or bleeding shock. As the name applies, this type of shock is caused by rapid blood loss. A victim of an accident or other cause of shock may not appear to be in shock at first check. A conscious victim may complain of weakness or nausea and may vomit. The victim may become restless or afraid. Keep observing the victim every couple of minutes for signs of shock. Look for shallow and rapid breathing, pale, cool, clammy skin, rapid, weak pulse, and unresponsiveness or unconsciousness. There are a number of steps you can take if you suspect the victim is going into shock. Keep the victim lying down. Keep the airway open and maintain breathing. Keep the victim warm, but do not overheat. Place a blanket over and under the victim unless spinal injuries are suspected. If there is no indication of a spinal injury, elevate the feet approximately 8 to 10 inches. So remember, if the face is pale, raise the tail of their feet, and if the face is red, raise the head, the shoulders, and the head. Burns. There are 5 basic classifications of types of burns: thermal or heat, electrical, chemical, radiation, and light. Several thermal or heat burns can result in loss of life. The severity of burns are classified by degree: first, second, or third degree. Degree burns only affect the outer layer of skin. The skin is reddened and pain is localized at the site. A mild sunburn is an example of a first-degree burn. Most first-degree burns, such as a minor finger burn, do not require medical attention. Second-degree burns pass through the outer layer of skin and damage the second layer. These types of burns are also red. A second-degree burn can cause blisters to form. Never break the blisters of any burn. Intense pain will accompany a second-degree burn. Third-degree burns are the most serious. Third-degree burns go through all layers of the skin and can damage or destroy nerves, muscles, and bone. Third-degree burns can be hard to distinguish from second-degree burns. They usually have charred areas or an ashy white appearance. The victim may not experience pain if the nerves in the burned area have been destroyed. However, first and second-degree burns usually surround areas of a third-degree burn. You can treat first and second-degree burns on 20% or less of the body's surface using localized cooling. There are several guidelines to follow when using localized cooling. Do not use localized cooling longer than 2 hours. Only use cold water, not ice. Apply cool towels or similar clean materials soaked in cold water to the affected area. Only perform localized cooling on conscious victim that can communicate their pain level. Cool the tissues until the pain of the burn ceases, not to the level that the pain is due to excessive coldness. Remember these additional points when treating a heat burn. Never remove burned clothing that has stuck to the burned area. Do not apply any burn ointments and do not break blisters. Cover the entire burned area with a sterile or clean dressing, treat for shock, and if necessary, contact emergency personnel. Electrical burns. Electrical burns are treated in the same manner as heat burns. The burned area should be covered with a sterile or clean cloth. The victim should be lying down or should be treated for shock. Regardless of how minor an electrical shock may appear, it must be reported and a medical follow-up performed. Even a minor electrical shock can cause irregular heartbeats. Chemical burns. If it is safe to enter, begin washing down the victim's burned area with large amounts of water. You must remove all clothing, socks, shoes, underwear, and jewelry to prevent the chemical from being absorbed into the clothing and remaining in contact with the skin. This is not the time for modesty. Rinse the victim for several minutes. After the victim has been thoroughly washed, cover the burned area with sterile or clean cloth to avoid infection. Burns to the eyes. A burn to the eye is a very serious injury and should be seen by a physician immediately. A heat burn to the eye should be covered with a sterile pad or a clean cloth pad. Moisten the eye pad with sterile water if available before placing it on the eye. A chemical burn to the eye requires immediate attention. Flood the eye with large amounts of water for at least 15 minutes. Radiation burns. Radiological considerations may take precedence if injuries are not life-threatening and pain is not a significant factor. After surveying the scene, determine if it's safe for you to enter the area. To care for the contaminated injured personnel, you must consider the following first aid priorities: treatment, removal from immediate danger, decontamination, and transportation. That's it for this training on basic first aid.